Hey everybody, it's Jeanette Kingsley, and I'm going to give you guys a presentation once again on postpartum conditions. The conditions I'm going to talk about is thrombophlebitis, endometritis, urinary tract infection, and mastitis, which are commonly found in postpartum women. The last three conditions on this page are postpartum infections or puerperal infection, which is any clinical infection of the genital tract that occurs within 28 days after miscarriage, induced abortion, or childbirth. And these infections usually come with the presence of a fever of 38 degrees Celsius, which is 100.4 degrees Fahrenheit, or more on 2 successive days of the first 10 days of postpartum, and that's not counting the first 24 hours after birth. So, thrombophlebitis is a condition that results from the formation of blood clots or clots inside blood vessels, and it's caused by inflammation or partial obstruction of the vessel. It's characterized by pain and tenderness in the lower extremities. Physical examinations will reveal warmth, tenderness, and an enlarged hardened vein over the site of the thrombosis. We're going to go ahead and treat this condition with analgesia such as nonsteroidal anti-inflammatory agents, rest with elevation of the affected leg, elastic compressions, stockings, and heat application. And so for the intervention as well, you want to go ahead and explain the diagnosis and treatment to the patient. Postpartum women usually need assistance with personal care as long as they're on bed rest, so the family should be encouraged to help her out. And she should also be encouraged to change positions frequently, but to avoid placing her knees in a sharply flexed position that could cause pooling of the blood in the lower extremities. So that's what we're going to do for that. We don't want to dislodge any clots causing pulmonary embolism. Next, we're going to talk about endometritis. Endometritis is the infection of the lining of the uterus, and it's usually a common postpartum infection. The signs of endometritis include fever, increased pulse, chills, anorexia, nausea, fatigue, lethargy, pelvic pain, uterine tenderness, and a foul-smelling profuse lochia. Blood cultures or intracervical or intrauterine bacterial cultures are done, and the reveal the pathogens come in normally between 36 to 48 hours. So the management for this is IV broad-spectrum antibiotic, and this could be like cephalosporins, penicillin, clindamycin, or gentamicin. And she's going to also need supportive care, including hydration, rest, and pain relief. So the antibiotics are usually discontinued after 24 hours that the woman is asymptomatic. Next is urinary tract infection, and this occurs 2 to 4% of postpartum women. The risk factors include urinary catheterization, frequent pelvic examinations, regional anesthesia, which includes epidural and spinal, genital tract injury, history of UTI, and cesarean birth. And the signs and symptoms include dysuria, frequency and urgency, low-grade fever, urinary retention, hematuria, pyuria, which is a condition of urine containing white blood cells or pus, and costovertebral angle, tenderness, or flank pain. Treatment is going to be antibiotic therapy, analgesia, and hydration. So we need to monitor this woman really closely for possible development of sepsis. A woman with mild to moderate disease or anything like a low-grade fever may be treated with oral antibiotics. All right, and the last one is mastitis. So sore, cracked nipples can lead to mastitis by providing a portal of entry for the causative organisms. Mastitis means inflammation of the breast, but it's normally referred to infection of the breast. Sudden onset of flu-like symptoms, including fever, chills, body aches, and headaches, are usually the signs and symptoms. The woman usually has localized breast pain and tenderness and a hot reddened area on the breast. Breastfeeding mothers should be taught the signs of mastitis before they're discharged from the hospital, so they need to know when to call their provider if the symptoms occur. The treatment for this normally includes antibiotics for 10 to 14 days and analgesic and antipyretic medication such as ibuprofen. The mother is advised to rest as much as possible and breastfeed or pump frequently. And the reason for this is that she wants to strive to empty the affected side adequately. Warm compresses to the breast before feeding or pumping is useful. And we need to make sure that she gets adequate fluid intake and a balanced diet. And that concludes my presentation. Thank you for listening.